have a lack of hip extension, or you have a lack of hip extension?
I'm pretty sure I do.
All right, so let's just check extension and standing. Is one side worse than the other?
My right hip feels tight.
Okay, so go ahead and palms on your back. Go ahead and extend. All right. And let's do right leg forward. So this actually takes his right hip out of the equation, actually right ankle out of the equation too, because with this you do need ankle dorsiflexion as well. That's an SFMA thing. So go ahead and extend. A little bit better. And go ahead and switch. Sometimes it's just a stability thing. Like if you can extend better both ways, it might just be that he can't do that. Although, does one hurt?
No.
No? Do you feel more of a pull in the anterior chain one side more than the other?
Right.
On the right side? Okay, let's see. Go ahead and lie prone. Let's look at hip extension actively and passively. Go ahead and lift this up. Good. And relax. Lift this up. Relax. Lift this one up. Yeah. There's a bit more of a lumbar contraction with this one, so it could be just difficult, or maybe he has inhibited glutes and hamstrings on this side. But I also like to check it passively. So Q scoots. Actually, I have enough room on this table. The way I like to check it is I'm going to put my fist right here, and I just want to tilt up into extension. So that is not as easy as I would like. Significant resistance, probably got about 5 degrees there. I also want to check in a pure sagittal plane. Many times people with a lack of extension, they end up like abducting and extending, or rotating their hip one way or the other. It's better. Still a bit of a hard end feel. So